Hey everybody, welcome back to the channel. Mental Health Over Everything is our new channel now, and I am at the Philly Med Club in Fishtown, Northern Liberties area. You guys kind of know if you're from Philadelphia where we're at, and I have Dr. Wayne with us right now. I'm going to be getting a vitamin IV, and vitamin IV clinics are, you know, the new rage right now, and I decided to help out Dr. Wayne because, number one, I've never done it. Number two, I think there's a lot of questions that people actually need to know when it comes to these. A lot of people, they don't know if it's safe. They don't know, you know, what the benefits are. And basically, I'm going to interview him and give him some questions while we both actually get some vitamins put in us. So we're going to do that right now. And while that's happening, I'm just going to ask some questions. So you guys can go and do whatever you got to do.
All right.
Are you okay with needles?
Oh, yeah, I love needles. Guess I'm not supposed to say that. Yeah, nah, I'm terrified of them.
I get a little twitchy.
I got you. So, Dr. Wayne, people that would actually want this type of therapy done, because this is kind of a therapy in a way,
Sure.
right?
Yeah.
So, I guess we'll get the basic definitions out. What is an IV clinic to you in your definition?
IV clinics tend to be medical facilities where you can go in, get IV hydration through your veins, essentially. So with it, some folks tend to need this for nutritional supplementation if they can't get it from their gut. So essentially, some folks will have some GI disturbances where they can't absorb certain nutrients. So with that, getting it through the IV gets it directly into the system, directly into the tissue.
Okay.
Others tend to do it because they had a little too many the night before, feeling hungover or dehydrated, or a lot of us working too hard, forgetting to drink water and drinking coffee half the day, realizing by the end of the day, all right, I didn't drink 1 cup of water. So it tends to really help folks out, speed the process up of just taking it naturally. So you're getting 100% of the IV in
Thank you.
right away, which is good. So you see them popping up more because
Treat you
people are
very
getting
nice
a lot
here.
of
Goodness. They asked me for a blanket earlier, and I said, no, I'm sweating a little bit, but they treat you very nice here. It's a very nice facility. But back to what we're saying, what are your ideal clientele here? I mean, is this A to Z? Is this, you know, your soccer mom? Is this the athlete? I mean, this, honestly, I guess anybody can do this, right?
Absolutely, absolutely. We get high-end athletes that come by because they want to supplement to their normal diet and nutrition regimen. Others are the weekend warrior where they want to prep up for the weekend and get as much hydrated as they can. So then the decisions they may or may not make that are good for themselves or not weekend, they're pretty much primed for it.
The camera that's on him, is everything good on him? Because I just realized she is in the way, but she's not fully in the way. Good? Perfect. Just making sure you're good. Don't worry, you are perfect. So the needle's going in, everybody. I'm terrified of needles. Wouldn't that be funny? Wouldn't that be funny? They don't need to know.
You have
Wouldn't
no
it be
idea how
funny?
many patients I encounter when I have to give them a needle. They're terrified and they're full tatted up.
It would just be funny if I just passed out while getting the needle, though.
Oh
Like,
my God.
could you imagine? Oh my God,
I
that
don't want to
that would be
imagine. Please
hilarious.
don't.
I'm sorry, that would be hilarious on my end. So again,
I'll be the first one.
right, that would be just. I'm sorry, that would be an awesome little podcast. But anyway, so I guess the biggest thing is, and the most common thing people ask, is this safe?
Like any procedure, there's a little bit of risk. So
Okay.
with IV hydration, you are putting an intravenous catheter within the vein. So there's risk of bruising, bleeding, infection. And outside of that, it's pretty rare when you're getting it done by an experienced clinician. So in reality, you may have a little bit of bruising thereafter, but most of the time it's painless there. It's a little bit of a pinch.
So the main benefits of something like this, I guess, you know, you're feeling amazing as soon as this is done. Because if I'm not mistaken, you know, immediately after this, you feel it as you're actually getting this done.
Yeah.
So this is not. It's not like something happens the next day. You're feeling it as soon as it happens.
Absolutely.
Okay.
Yeah. So I have a lot of patients that will come in because they suffer from chronic migraines. And when they get into one of their migraine cycles, this can help. Well, we would add a medicine to piggyback off of the IV hydration. And that really, by the end of the IV bag, they're saying, my headache's gone. I'm feeling out of the clouds again. So it really can help folks that suffer from things like chronic migraines or just dehydration, or just to feel you're optimal. So, and that's where I think it can help a lot of folks out, and it's something that, you know, I'm pretty happy that we have here because it goes along our mission of wellness. So if we can supplement to that, absolutely. And it's very safe method of doing it. And you're right, especially with with vitamin infusion. We do certain ones that have energy metabolism, what have you, and they, at the end of it, you feel like, oh, I feel like a clean energy, not like something you would have drinking a Celsius or something.
Yeah.
Where you feel like a little bit of a crash there.
No, like jittery or anything like that.
No,
You just kind of feel almost like a different you.
Mhm.
You're just
Refreshed.
up and about. So what are the, I guess there's a lot of vitamins, but what are the most common ones that people come here and ask for? I'm
Commonly-
assuming like vitamin C is probably the top one as well.
Big one in there, the B complex. That's typically infused in all the lines.
Okay.
But if you're looking at recovery, then you're going to have a little more B vitamin in there. Things like niacin, branched chain amino acids is thrown in there, which is great for recovery because getting it through the intravenous is, it gets it a little faster to the muscle.
For sure.
Than it would be by drinking it, within a shake or whatnot. And that's the biggest benefit. You're getting it directly in the vein. So you're getting it to the areas that need to and bypassing that digestive tract.
Well, I know that some people, a doctor prescribes them to get B12 shots, once a month sometimes.
Sure.
And I knew a couple people when I used to actually train people and give them diets. They said, yeah, my doctor said I need to get B12 once a month. And I guess instead of going with, you can come right here, get it done. Do you have to schedule to come here, or is it usually walk in, or how does it go?
So we have both. We do scheduling and walk-ins. We accept if we have the appointment available, essentially.
Okay.
So, but mainly we do it through our website, social media. We're able to do that as well on our Instagram or Facebook. You can book, or just traditional phone calls.
Okay, so again, when they come in here, how long is the process they're getting it done? They're going to be in here an hour, a half hour? Does it depend on how much they're getting done, or what else?
If typically it takes about a half hour to max an hour, and
Okay.
a few things can influence that. Definitely hydration status. If folks are dehydrated, they tend to suck up the fluids pretty quickly.
Okay.
So myself here, I may suck this up in about 35 minutes, 40 minutes.
Oh, okay. And the podcast might only be 30, 40 minutes, so
right.
we might be right on time.
Yours may be
I
a
know
little
I'm a
slower.
little
'cause you
dehydrated
look-
today.
Are you feeling a little bit?
A little bit, yeah.
Yeah, and that's been hitting a lot of folks just because of the heat, So
Yeah, for sure.
definitely help with that. That's why I'm very happy to have this so close to home. And for a lot of folks in the neighborhood, it's an easy walk-in before they go to work.
So the average person, someone that's somewhat healthy, how many times do you suggest them to get this done? Just get it done once a month? Could they get it done once a week? What, do you see people coming in here every weekend, something done? Like, what is it?
I think it depends on what they have going on that month.
Okay.
So again, for folks that come in, we get a lot of folks that do jiu-jitsu, and they typically get this done once a week, because a higher end athlete, they're definitely going to need that recovery.
For sure.
So this really helps supplement their workouts, and so typically once a week for those folks. Others, they may just get it once a month based on what they're doing. So we get a lot of folks come in before a bachelor party, before a wedding weekend, and so they'll get hydrated up and go out and do their thing.
So I guess the most common question that people ask so no one really knows this, but I did post something on my story asking everybody, hey, has anyone ever done this? Any IV clinics or interested? I said, if you guys are, ask some questions. So the most common question, which was question number 8, is it expensive?
So tends to runs about $150 with a vitamin infusion.
Okay.
There is a difference in maybe $10 based on what complex that you get.
Okay.
Yes, depending on each one, it ranges from 149 to 159.
Okay.
But if you do, I believe it's a package of 4 or 5. It is $549.
Okay.
So I think
So you guys
that-
get bundle deals and packages?
Sure. Yeah.
Okay, great. So I'm assuming, let's just say a mom comes in here and says, hey, I want my kid to get, once a month something done. They can come in, grab a bundle package, and then they can tell you, hey, we want him to do this. Okay. Hey, that's awesome. Some places I don't think do bundle packages. I've seen it with laser hair removal and stuff.
Sure,
but
yeah.
I don't think anyone wants to do those procedures. I did it once and it didn't work on me. Actually, I did it
Is
8
that right?
times. No, I did it 8 times. I went away for a month and then came back. Yeah. I'm full-blood Italian. I'm hairy. I'm a gorilla. Yeah.
You and me both. She did my ears the other day because I was tired of plucking
I
them.
did.
And luckily they were.
Yeah. Well, there you go.
Yeah, come out. Sam is great at that. She did 2 sessions on my wife, and she maybe needs another one. Typically, you need about 4 to 6. So she's good. She's been. My wife's been getting on me to get that done
That's a
since
good,
we opened this place. maybe I like it, you know.
It was a good 6 weeks, and then everything came back fully, and I was like, oh my god. So I guess another question is, that was the most common, does it hurt? Now, as you guys see, we're actually talking while getting this done. It does not hurt. Again, if you're scared of needles, you know, it's still a simple procedure. But as far as hurting, no. As soon as, you know, you're getting the fluid in you, I mean, it's flowing through and everything's doing great. But what was the next question that well, obviously people were asking what the health benefits. We already discussed that. What are the ingredients I'm actually getting today in these IV bags?
Dr. Gavami, you can take over on that because it's a mystery to me.
So we did the recovery for
Okay.
both of you today.
Okay.
What it actually has, it has a full complex B vitamin. It has vitamin C. It has full complex of amino acids, and those are the essential building blocks of everything that almost happens in our body.
Okay.
We're getting that, and you're also getting glutathione on top of that. So all of those together will actually improve your hydration. It will improves your energy.
Okay.
And it really gives your cells the ability to recover and rejuvenate.
Okay, awesome. Now, I did read a couple articles on this, and some people do have belief, and I don't know, like, if this is a myth or not, but some people actually do this for anxiety. Some people say that there's certain vitamins that they take that can actually lower their anxiety. Some were tiptoeing around the depression area, and due to the mental health stuff, you know, I always look into this stuff, but is there anything you would suggest that this can calm people down from anxiety issues or anything of the sort?
Yeah, absolutely. A big reason is that, one, you're getting the maximum benefit out of the amino acids, the B complex, the vitamin C. All that really helps the immune system. It helps the energy in your body, helps your metabolism. So if you're feeling better throughout the day, you're going to be doing more that you enjoy. You're going to be feel more motivated. So when you're accomplishing more, you're going to feel.
Tattoo.
You know, you're going to feel.
No. I'm saying I just
Your
have my
heart's
arm.
sick,
You have a lot of
and he's
yeah.
a doctor, so if I couldn't get it,
Yeah.
I feel very good that
Big
he's
muscles,
not able to
but-
get it.
Sorry.
big muscles.
Tends
but-
to happen. That's my brother as well.
Definitely
He's
dehydrated.
got like a 1/2 centimeter vein in there, and that thing just likes to collapse every time.
Yes, when I go
get
to
it.
American Red Cross and donate blood, they always say I'm hard sometimes. I said, how am I hard when I'm vascular? Like, they're like, it's just different when it comes to donating blood.
Those, I mean, tend to be squirrely. Like they can move around a little bit. We can do an IO. I mean, we do those here as well. If you want to just go right into the bone, little pinchy.
Right
But,
to the bone. Great.
Hey, last resort, you got to get it in
So,
there somewhere.
another question. Everybody, so you know, the IV's taking a little minute for me because my muscles are so big from what they're telling me.
Mhm.
We're going to do the other arm. How do you want me to do it?
I'm just going to turn you towards me just a tiny bit.
All right.
We were thinking about going to med school. We met back at Temple, 2001, and he kind of influenced me to go towards the track of being a physician because I was looking at dentistry.
Yeah.
I'm kind of happy I switched over there because,
I hear you.
as most physicians, we don't really looking in folks' mouths. So we wanted to have our own clinic and outside of the hospital system because
For sure.
even then we knew that there's a lot of restrictions on how physicians can practice medicine.
Yeah.
And over the years, as we got further into our career, we wanted to distance ourselves more
I feel
and more
so good right now.
from.
This
being-
is such a great feeling. But
yeah, it's
continue.
nice. It's nice, man.
I feel nice and cool. I feel.
You got to catch up a little
Am
bit.
I supposed to feel hydrated? Like I don't feel thirsty right now. I know that. I feel
You
great.
may have to pee in about a half hour or so.
Yeah.
Yeah.
Well, we got about 25 minutes left of this, so.
Yeah.
But
So-
just to let you guys know, you know, this is all live right now. You know, just the experience I'm getting right now. I just feel very relaxed right now. Number one, but number two, my arm feels nice and cool. My body always runs hot. I believe it's the cool substance going into my arms right now, but this feels very nice. And there's nothing else going on. This is great. This is an awesome experience. But back to what we're saying, the mission at hand with you and your partner, you know, you guys envision this to happen, and it looks like you guys are doing very well. Is there anything else you want to actually put out there as far as, you know, because I know you guys have other services, right?
Sure.
What are the other services you guys are offering here?
So we do primary care, concierge medicine. So we see patients as you would in any traditional family practice.
Okay.
We also do neurotoxins. So we do Botox, filler as well.
Okay.
So we do facial aesthetics along with our primary care. We also do laser, so we have laser hair removal here. We do microneedling. We use both with the pen with PRP, which is very beneficial for folks' face, as well as a Morpheus 8. And there's various utility with using that type of microneedling.
So I've heard microneedling. Why don't we go into a little bit in depth with that?
Absolutely.
With microneedling, what does that entail?
So it entails using a device. If you're using the Morpheus 8, it has multiple small needles on it that actually get injected under the skin between possibly 5 millimeters up to 7 millimeters, depending on the body part. And what it does is cause small micro injuries to the skin and therefore allowing the body to start its own healing process. And with that, it generates more collagen, elastin, fibrin, so all the good growth factors and support system within the skin. So a lot of folks after 25, you start to have the gradual aging process.
Yeah.
You can reverse that using microneedling. It just tightens everything up for where you were when you were younger. So it kind of rejuvenates the skin. Use it for a multitude of applications. We have folks that suffer from severe cystic acne, where later on in life they're tired of covering up the scars. This helps with scars, whether it's acne or others. They've had C-sections and want to cover up that scar, so it works great for that.
Okay.
I think the Kardashians use it for their whole body. They may have one in their own house, to be honest with you, because it's great for like cellulite treatment, because you can do anything under the sun.
So how do you treat? So you treat that with cellulite, the same process?
Yeah.
Okay.
So, and then what makes the Morpheus 8 different than a lot of the devices out there is the fact that it can go deeper into the subcutaneous fat, and it emits high energy heat waves, and with that, it's going to help emulsify and burn fat. And you see that over the course of 3-4 weeks after each session, that your body eventually.
Is it the machine you were telling me about when I came in here?
So that one's actually an M-Sculpt machine. That is similar, where it uses high frequency heat. So that can also burn fat, but in addition to that, it'll build muscle.
Okay.
So, and with these, you tend to need a few sessions to really get the maximum benefit from it.
So do you guys have any services for people to get, obviously plastic surgery done, like say they got a BBL done? What would you suggest somebody that's trying to keep up with, having a BBL? Because a lot of people think as soon as you get that surgery done, that's it.
Sure.
But there's other things that you have to do to make sure that's still shaped properly and, you're still, it's not falling apart. What would you suggest for somebody that, got a BBL done?
So everybody's a little different. So depending on the deficits, if there is still an issue with cellulite, that's where the microneedling comes in and can help bring that down. There's also use of injectables like Kybella, which has been very famous for the submental fat. So a lot of folks, they may end up getting a lift plastic surgery done, but over the course of several years, aging process is going to happen. You're going to have some loose skin or a little bit of excess fat there just from your diet, what have you. And so using injectable like Kybella can help shrink that fat area. So there's ways you can target and help really maximize the benefit from a plastic surgery, because that's one thing. We do all non-surgical aesthetics. So for a lot of folks that we can't take care of because of certain deficits, we say, yeah, absolutely, I think plastic surgery will be the best for you. But thereafter, you can maintain those results with certain things like the Morpheus 8 to keep you staying young and having that fullness that
I know there's a limit to this question, but I'm assuming you guys have probably had horror stories from other doctors or other places where they came to you guys for help.
Sure.
Does that happen quite often, where people come to you guys for advice and you end up steering them either the right way or being able to help them with your services?
And I think that's what we pride ourselves with, is that we're not trying to just fill somebody's face with Botox or with filler, because the way you look coming out of here is a representation of us.
For sure.
So we're more on the side of caution, where if someone's new to Botox, we tend to go on the lighter side, see how they like it, and then always have a free consultation for a follow-up to see if they need any more additional, because you can always add more, but taking back certain things is more troublesome.
For sure.
For things like filler, a lot of folks, lips, everybody gets their lips injected anymore, but they go a little too
I've seen
far.
horror stories on Instagram. I've seen people, I don't know, whoever's on TikTok that sees some of the plastic surgery pages where people are like, don't do this and don't do that. And, I think that's something I do want to help you guys with as far as, helping you guys with TikTok and getting the content where, you know, you can review certain stuff and say, hey, this was done wrong, this and that. And I think that's great content to put out for people because, number one, there's so many young women out there that, you know, they just want to look a certain way and they just go with almost any surgeon or any person that's doing the fillers and they end up going with the wrong person and then they end up suffering. So it's a good thing that you guys take a lot of pride in that because there's some people out there that are just doing, you know, a paper mill, you know what they say, you know, just bringing people in, shooting them out and getting them out of there. But I think that's very beneficial to educate the community, you know, especially with young women trying to enhance their bodies and, you know, doing it the safe and proper way. And I'm glad that, you know, we can talk about this because I have seen just so many people that have just, again, you know, viral videos of people saying, hey, I should have never have done this. So, you know, it's kind of reassuring knowing that you guys are taking a lot of pride in that. But moving forward, what are the other services that you think that a lot of people will come to around this area besides it? I know this is very popular because I already know a handful of people that have already showed interest and said they want to come here.
Sure.
What else are you guys offering that a lot of people don't know about until, you know, you put it on the website or you guys actually advertise it? Or is there anything in the future that you guys are bringing out with?
So we right now, besides the, you know, the microneedling, PRP, we're really we're excited to start advertising more on that because we see a lot of benefit in things like sports medicine. For instance, a lot of folks will go get steroid injections in the knee over and over again.
Yeah.
That can slowly degrade the cartilage and really make you worse off in the long run. So you can get great benefit from it, but overdoing the steroid treatment can really degrade the knee joint or the elbow, the wrist, where have you. PRP is one of those that we do offer for joint injections where majority of the time the insurance isn't going to cover it, which is unfortunate because, you know, it's only a 50-50 benefit. So some folks find great relief with it, others don't. So that's where insurance is still, we're not going to pay for these types of procedures if we don't see 80 or 90% of people benefiting from it.
Okay.
But in our case, we do joint injection with PRP, and we have a lot of folks that are coming back. You know, they'll get a few sessions, get optimal, and then yearly get just a follow-up with it. And then we also do it for hair loss. Because that's one thing I think a lot of guys are reluctant to go to a med spa or an aesthetic practice because they think it's just for females.
Yeah.
And the reality is there's so many guys out there doing things like dermaplaning and whatnot on their own behind the scenes.
That's another thing. I think that men, that stereotype is so big now where men just think it's so feminine to come here. But I know a lot of men are doing all that. I actually know men that get Botox done.
Sure.
And to be honest, I think as long as you don't overdo it, there's nothing wrong with it. And a lot of people, I think there's a misconception about Botox. Botox can be safe. And it's only if it's done properly and you don't overdo it. Now, what are some interesting things that you think people don't know about Botox? And I know some people that say they get Botox done to limit headaches. I know some people get Botox done to stop sweating in certain areas.
And you know what? And they tend to be the happiest of the group after a week or so. We had a fella here the other day that has what we'll call hyperhidrosis.
Yeah.
He sweats profusely, and he's in a public eye. He's a realtor, and he one session after getting, actually we did Morpheus 8 because you can use Morpheus 8 for hyperhidrosis, the microneedling, as well as the Botox. And after several weeks, it went from buckets to beads. And he said, I can live with this.
That's
and then
insane.
doing another treatment with the Morpheus 8 can permanently remove a lot of those sweat glands. You don't remove them all because you still need sweat glands, but you move the majority of them that are hyperactive. And it's a game changer. I mean, you're going to save most of your clothes. Like my wife yells at me all the time because a lot of my nice shirts are destroyed because of over sweating. So I gotta get my butt on that machine soon, especially the dead of summer here. It's getting
What
awful.
are other
Botox
things?
is one to set as well. Botox, you can start to cut you off there. I
No,
got a little
no,
passionate
you're
about
good,
it.
you're
like,
good.
Because we use the same for folks with the armpit sweat, the forehead, the bottom of the feet.
Yeah.
Bottom of the feet could be a little cumbersome because you're putting needles at the bottom of the foot there.
Yeah.
But for some folks, you know, it's a game changer for them as well.
I just think a lot of people
but
don't know that you can do multiple things with
so
Botox.
many things with Botox.
A lot of people think it's just facial stuff. But again, at the end of the day, there's multiple things, and people don't know unless the information is actually out there.
Absolutely.
And that's why I always say video content like this is king, because, you know, you have no idea. Do you want to comment on any of this? Put the camera on him, Nestor, please.
Yeah, there's a lot you can do there, and he's
the
takes a lot of pride in
mic's
it.
on up top, right? Yep, good to go.
So one of the things, as my partner, Dr. Raniero, said, you very nicely put it, that there's a lot of different things you can do with Botox. A lot of people think that Botox is primary just for aesthetic reasons, and don't get me wrong, I actually just had my forehead done by Dr. Raniero a couple minutes ago, well, a little more than a minute ago, but it really is just to relaxes the forehead, it gets rid of the unwanted wrinkles, but at the same time, as you can see, my face is now frozen. I think that's one of the things that guys are, we're a little bit more hesitant to get it, because we think that, we're going to have this frozen face that you can't make, any of these, your normal facial features.
For sure.
But we always tell people, that there's a difference between men facial muscles as well as the women. So, the dosage is different, the injection points are going to be different. Another interesting thing you said, as far as like other things that we can do with Botox, for example, for masseters, we have a lot of clients that they come in, we have to have TMJ or to grind your teeth at night. They're grinding your teeth, and I'm sure there's a lot of people that they're
I'm one of them.
that you grind.
I'm one of
your
them,
teeth.
yeah.
Exactly. Especially at night. We have
Yeah.
a lot of people coming in and telling us that their partners can't sleep because they can hear the other person just grinding
Yeah.
away at night. And one of the things you can do with Botox, you can actually inject the masseter's muscles. And those are really these two big muscles right over here that you use it to grind and go back and forth. And what you could do is you could actually inject these muscles. Now, for a lot of people that they have problem with grinding, that does really reduce the grinding at night. It saves your teeth, it saves the relationship. At the same time, you will have better results from it. That's one of the things you can do with Botox. Now, some females
There's a lot
even
of
use
things.
it to thin out their jaws, to kind of give them the little heart-shaped face that that is so sought after. So again, it can have clinical benefits, which is reducing grinding, saving your teeth, as well as having some benefits aesthetic-wise as far as the face goes.
Yeah, I think you've obviously can admit to this in the last, 10, 15 years, plastic surgery has gotten insane in some areas, but, I think general health is coming back where people want to do it a much safer way. And like I said, content is king when it comes to this stuff, because there's stuff I'm learning right now that I never knew. I mean, the teeth grinding, that's been one of my issues for a very long time. I have a mouth guard at night. So, I mean, there's so many other things that people don't know that this is beneficial to, that they just think of the worst things, where people are just like, oh, I don't want my face to be stiff. Oh, I don't want this. I don't want that. But there's actual other cosmetic stuff it can do and health benefits to this stuff. So I want that stigmatism to go away, where people are saying that, this isn't helping people. It does help people in many ways. Like I said, I did know someone from my previous job that got it because they were getting migraines all the time. And they said it helped them out. They said it helped them out a lot. And this stuff right here is beneficial to the average consumer that is thinking about it, but they're too scared to research into it, because the more you research online, you start seeing, if things pop up where they're saying, oh, this horrible accident that happened, oh, this happened, I'm glad that you guys have a better mission than most people, where it's not about making an income, it's about making an impact.
Yeah.
You know what I mean? And that's a really big thing there. It's,
To what you just said is, we were talking about fillers earlier.
yeah.
I've had clients coming in, and I have talked them out of getting their fillers, because like you said, there's a lot of stigma behind look and self, like people are a little bit more conscious of their body, but at the same time a little bit,
Well, the
lack of a better
thing
word,
is,
they're worried about how they look, and they
Yeah.
think like, the answer would be to get the filler or to augment their lip or jaw.
yeah.
And I think part of our job as far as the healthcare providers is, is again, going back, I tell my clients all the time, I would love to take your money. I'm not going to say no to money. But at the same time, we both have a level of ethics that,
Well, it's
plays
reputation
into
as
it.
well.
Exactly.
Got to remember, they're a billboard. So when they go out to the club, they go out to lunch, something, they're like, oh my God, who did this to them? And again, I do think, and I'm very big with mental health, obviously being a mental health channel, that there are some people that,
their mental health goes downhill and they start attacking their looks and they start thinking, hey, if I get bigger this or if I get this done, I'll look younger. And it just sometimes, I mean, have you ever had certain clients where you felt that you had to talk to them a certain way because they were seeing something different than what you guys were seeing? I'm sure it happens all the time. We're like, I need this, I need that. And I don't want to say people have mental health issues in that aspect, but I think that they start looking at these magazines, these TV shows, and they want to be somebody that they're not. But who they see in the mirror is completely different than what you guys are seeing. Absolutely. You know what I mean? They don't look at themselves as a beautiful person unless they have all this in their cheeks. And then you guys obviously like, hey, listen, you don't need any more than what you got. I suggest doing this and that. And that's a very big, like you said, with ethics. We need a lot more people with ethics out there instead of taking money, because I go out to these nightclubs, I go out to these bars, and I see some plastic surgery done. I'm like, where did you guys get this done? And it's a shame. I actually knew a girl that got, a little off topic, I knew a girl that went to Mexico and got done breast augmentation, and she ended up having 3 more surgeries after that in the course of 2 years, because I don't know the technical terms, but she just said that she should have just went with the money with the people in our country instead of going down there for a cheaper price. And again, the biggest risk with that is, you have some people dying now. I don't know if you remember, there was a woman that was a mother that went to, I believe she went to Mexico, and she had a breast augmentation done, and she had died like 3 weeks later. And it was from a bad infection, and that's the biggest thing right there.
Part of our job, I still work inpatient. By inpatient, I mean I still work in a hospital.
Yeah.
And as an internist hospitalist, we do see these cases coming in with infection, surgical site infection.
Yeah.
And you're saying Mexico or Colombia, and you think like, going outside the country is dangerous. We have people coming in from different states, especially Florida, that are coming in with the BBLs that have gone wrong,
Yes.
with the liposuction that has gone wrong, and the breast.
I cannot tell you how many times I've been in Miami Airport and there's a girl next to me sitting on a pillow or something, and they're on the phone saying, I just got my butt done. And I'm like, and again, I see so many of them in the Miami Airport.
And if I can impart any information or any advice to anybody that's watching this right now, and that's what they're thinking.
Yeah.
I can tell you firsthand that, once you come back to your state, just because the surgery was done by a surgeon inside the United States, it doesn't mean another surgeon is reluctant to go back in and kind of clean up the job that they've done.
Yeah.
So a lot of times now you're stuck going back and forth because you can't reach out to your original surgeon that did the procedure. And now you're here at a hospital with another surgeon, and they're also very reluctant to go back and to touch anything because that can fall back on them. So you're going to feel some, I don't want to call it pushback, but you're going to feel some, reluctant, some hesitancy from other healthcare professionals to get involved in the case now, because technically now you had a bad outcome, now you had an infection, and now somebody else needs to go and, fix it.
For sure.
So it's not just the money that you saved, it's that, it's really by doing the work, done at a reputable place, local to you, so you can kind of like hop in and out of their office as opposed to fly back and forth between their office.
Yeah.
Because if you're infected, if you are sick and you need immediate medical care, you're not going to be able to hop on a plane and fly back to Florida or Colombia, and you need to get it done locally. And having your surgeon locally, that certainly, helps you long term.
For sure. I actually, when I used to be a sheriff in the city here, I actually sat through the Black Widow case. I don't know if you guys ever heard of the case, but it was a transgender man that was injecting women with caulk sealer. So what he was doing was he did it so I don't know how many women had died, but he basically was giving BBLs out of his house, and the type of sealant that was being put into these women was actually something you got at Home Depot on sale. And they found tubes of it apparently in the house. But a lot of people actually died from it, and apparently there was hundreds of cases of women that he actually had taken care of, which again, apparently they said, it doesn't happen until it hits the bloodstream. So that could be anywhere from the time it starts till years later. And there were so many women I heard that were trying to get it removed and everything else, and a lot of surgeons said, we can't touch this. It's just, this is such a dangerous procedure, and it's a shame because, you know, people are trying to look a certain way because of, you know, the way TV shows are now, celebrities and whatnot. And it's a real shame that they try to go the cheaper route where they end up getting hurt.
Was
And
this a
that's
physician that was doing this?
No, this is just a random Joe Schmo with a needle,
Wow.
with just a big needle. And it, yeah. And
Wow.
it was crazy.
One of the things that we do have here is the M-Sculpt machine.
Oh,
We
yeah.
talked about, you know, the other things that they can do to maintain
Yeah.
the BBL. Or again, we're not doing BBL here, but with the M-Sculpt machine, there's an option that you can actually put it on the gluteus.
Is that the suction cup looking machine, or is that another machine?
I don't. Well, I'm sure we can like show you a video, a picture of
We
it.
can always do a little demonstration on it later.
Yeah, we
See
could
how-
try it. I'll
how-
try it.
how
Why
high you can
not?
go up on that one.
What'd you say?
It uses electromagnetic force to kind of excite the muscle.
Okay.
Each session of 30 minutes is equivalent of whether if it's on the abs, it will be equivalent of doing 20 sit-ups. If you put it on
20,000 sit-ups.
20, sorry,
20,000.
20.
Yeah, I mean, get that
Wow.
right, baby.
Yeah.
I can do 20 sit-ups right now, yeah?
And if you put it on the back muscle, on the butt muscle, it'll be equivalent of 20,000 squats,
Wow.
and that is in 30 minutes.
We'll definitely give it a try.
Yeah. You can do your butt, baby.
We'll give it a
I
shot.
saw that walking in, you know?
Yeah, right.
In 30 minutes, you can like literally like, you know, look up Google or Google. You can like browse Instagram for 30 minutes. And
Yeah.
It'll be done before you know it.
Yeah, the biggest thing I've been seeing on TikTok right now has been the suction cups on the girls' glutes, and to be honest, it doesn't. Again, it just looks funny to me because the suction cups are very large, and like I said, they're pulling the person's actually glute all the way up there, but it almost looks unsafe. But that's the new thing that they're saying to maintain that bubble butt from what people have been saying on TikTok, which is it's insane.
And, you know, those are all
I think it's just a temporary
Mhm.
type thing.
exactly.
Yeah.
The M-Sculpt, you know, you build the muscle and the muscle is yours.
Yeah, I've been hearing about the M Sculpt. Like I said, I knew somebody over in Jersey that got it done. They said they love the benefits of it. But you guys offer that here.
We do offer that here, and one of the, again, another side effects or side benefits of the M-Sculpt is, especially if you do it on the abdomen, that they're working on, they're publishing the studies, but it actually has shown that it actually reduces the fattiness of the liver as well.
Wow.
And that's one of the side benefits, I should say, that you get from the M-Sculpt machine.
How many percentage of people walk around with NASH? Non-alcoholics, steatosis?
I think I believe that I live a healthy lifestyle and I barely drink. Maybe
Yeah.
a drink here and there, and they had an ultrasound of my liver done before my gallbladder had to come out, and I had NASH.
Really?
So a lot of people, we all walk around with it.
It's tough to eat clean in the Western diet and the way we live.
It definitely
That's
is.
one thing you try to promote is just, you know, good, healthy lifestyle. And then honestly, if you're looking good, you're feeling good. So, and we try to do it all.
I feel
here.
energized right now, to be honest.
Yeah, you know
Not
what? You
that
sucked
bad.
that out. You sucked that up pretty quick. Am I running?
I'm about to
full?
say, because
I gotta push that out, man. You're beating me here, and you've been on
Yeah.
there about 10 minutes, 20
you
minutes.
got
20
a
minutes.
head start. Now I'm already done. I feel great. I don't know if that's why I'm smiling so much. I feel great right now.
We added a little something in there, you know.
But
Not to
again, you
disclose.
know, is there anything else you guys want to add, you know, as far as, you know, what does the future hold? You know, what do you guys expect with the future of this place? You know, do you want to open up more? You know, do you want to have more services? You know, what is it that you want to tell the general public, especially with the health concern behind it, you know?
Well, we definitely want to perfect what we have already, and there are other services that we are planning on bringing on, like hormonal therapy. The only thing that, you know, Dr. Nader and I would both
Like
agreed
TRT
on-
or?
Yeah, exactly. Yeah. One of the things that him and I agreed on, that we like to pick the select services that we think that's going to have the most benefit for our clients.
Okay.
And we as providers believe in it, as opposed to me just, you know, swiping the credit card and just hope that
For
you know,
sure.
you're going to be happy with it. One is that, and then once as we perfect this, of course, you know, we would like to, you know, expand this idea to other locations. But one of the things that I think I'm very much proud of this place is that, like we were discussing this, you know, I know majority of our clientele are female clients, but you know, we are getting some male clients as well.
Yeah.
And one of the things that we try to do with this office is to make sure that it is friendly to everyone.
Oh, yeah, for sure.
You know, so
The stereotype and stigmatism has to end now because, you know, the whole thing where men are saying, oh, you're feminine doing this, but
again, and that's the reason why I want this information out there, is because, you know, there's so much stigmatism on Botox. I've actually know quite a few men that get it done, but they're a little secretive about it, and I understand why. Nobody wants their business out there, but it's just funny that men still think that this is only women doing it, when, to be honest, I think it's 50-50. I mean, it really is.
100%. I think we all
Yeah.
stay the gun. You know, I mean, nobody wants to look like a.
For sure.
Yeah, my wife took a picture of me from behind a couple years back and noticed I was losing my hair right in the beginning of the pandemic, and I almost had a heart attack. I was like, "You got to be kidding me!" And I know it's like, okay, there could be worse things that can happen, but
Yeah.
for, you know, it's like, nah, I can't not now. So I got on the Rogaine kick, and now we're doing some PRP on my hair. I said, okay, and that is some tremendous results with PRP in the hair.
I've heard so many things about
And
PRP.
it's natural, you know.
Yes.
And that's what gives piggybacks of what Dr. Rahman was saying, is that we're trying to use things and do things in here that we know have good positive net benefit.
For sure.
We're not trying
No
to just,
smoke and mirrors.
exactly, and trying to go through a lot of the fluff that we see out there, because especially getting into the aesthetic industry, there's a lot out there that is just kind of like a dog and pony show essentially. And
Yeah.
so trying to get down to the actual science of it, to say, okay, is this actually beneficial? Who's doing these studies? Who's funding them? And how many confounders are there to say, okay, this is actually beneficial versus what you want to reword it? Because there's a lot of stuff out there that you can read an official study and it'll be a bunch of bullcrap.
Yeah.
So you got to be careful, and it really shone light in the pandemic, because I worked primarily a COVID unit out west throughout that time, so we had a lot of folks saying, hey, I've done my research and this and that, and I'm like, I have my master's, and it's still very hard for me to comb through a lot of these
For
studies,
sure.
because they do it in such a way that can really be convoluted and confusing. So in that respect, we're really trying to utilize only what we know is going to be beneficial for folks, and
For sure.
that tries to be more natural in a way. So,
Yeah.
for instance, when you're saying a lot of folks, you know, what people come in with certain complications, we see a lot of it in filler. Go overboard with how much filler they have that we have to dissolve them. So we can't even touch them until we dissolve them, because they're just overblown. And you're getting at more and more. So you're seeing a trend towards trying to go back to natural beauty. You know, you don't want to walk into a room and see lips. You want to walk in a room and see the whole person.
Yeah. For sure.
So when you talk about folks walking around saying, hey, where'd you get that done, this done? Honestly, it's a subtlety, because when folks walk out of here, you know, they realize, oh, wow, you got that done? Oh, my gosh, yeah, that looks great. But it's not sticking out in their face. So we're not trying to put billboards on people's lips or whatnot. You know, you're really trying to make this subtle, enhance
sure.
people's natural beauty. So otherwise, you're not going to look natural. And you see this now with folks getting cheeks done. You're getting too much done, and you don't need
I
all
see
that,
so
you
many
know?
people. I see so many people now. Or are we talking about cheeks down below or
Yeah.
cheeks up top? I'm about to say facial
we can
cheeks.
talk about
Yes.
both, but
The facial cheeks, though, I will say, I've seen. Like I said, I go out to bars, I go out to
Yeah.
events, and I see golf balls sticking out of people's faces, and I'm just like, at what part? And again, the last lady I saw did that. She was in her 60s, and she thought she was the hottest thing. Had everything done, the butt done, you know, the breast augmentation. I'm just like, oh my god.
I mean, if she's happy, more than
That's
fine.
fine,
you
but
know?
I just it goes back to the integrity part and
Mhm.
the ethics. Is that, you know, where are the ethics at with some people, where you say calm down, slow down, but I guess some people go to multiple surgeons, doctors, whatever. They're willing to do whatever, and it's a shame.
And that, you know, you can't control, but we try, you know, just try to, you know, educate folks as much as it can, and
Yeah.
then even give them some time to think about it, you know, because after a conversation, they may realize, you know what, maybe we're going overboard for the wrong reason.
Yeah, it's also true.
I feel like the Botox and filler like goes hand in hand with people my age as well, because I feel like, you know, going off with people that are in their like late 20s, 30s, 40s, 50s, 60s that are all getting Botox and filler done. I mean, I'm 22, so I feel like it's really popular in my generation right now, or at the age that I'm at right now. And I feel like a lot of girls that I know are either getting done like really, really good work, or they're getting like really bad work.
Yeah.
And then if they get bad work, they go to people that are reputable and are able to fix it and everything. But I feel like there's a lot of backlash for girls my age that get it done. But I mean, it's preventative, so like a little bit like goes a long way. So like, you know, say she does have a few like forehead wrinkles, like I get it done, I get it touched up. We call it baby Botox.
Yeah.
And it just prevents it from you getting it when you're older. And I think that that's fine, but there's definitely like a time and a place where you should be getting like excessive amounts. And I feel like girls my age just like want all of it when they only like really need a little bit to enhance themselves.
I think, and that's what we were saying earlier, that content is king, because more people have to talk about this for it to be understood, because, you know, a lot of people don't want to talk about it because they're ashamed to know. But when you actually put the information out there for people to see, you guys got to remember that, you know, you guys are making a difference in the community, you know, and the type of stuff you guys are doing now, you know, you guys have only been open how many months?
About 2 months now, right?
2 months now.
Yeah.
I can't see this place not flooded with people, especially after doing this. You know, we're showing the ethics, we're showing the perfection here, where you guys are trying to perfect everything to make sure that you're giving good quality services to people. You know, I'm extremely impressed with it as well. And like I said, the IV stuff, I'm going to be coming back again, because this is something I've been trying to do for a very long time. But just being in the mindset I am now of trying to stay healthy, you know, this is stuff that I want to do to keep up with. And, you know, I would never think about doing Botox until having this conversation now of just knowing the health benefits behind it. You know what I mean? And there's so much, again, stigmatism on this is bad for you, this is that. But I think people are just focusing on all the news articles and all the things going on where it's gone horribly wrong because people haven't done their research. So the only thing I have to say is, like, you know, I hope we can continue this content to educate the community, because there's so many benefits here that people don't see. And I feel like the more they know, the more comfortable they'll be coming in weekly, monthly, whatever it is, to do stuff like this. So what's your guys' Instagram, by the way?
Philly Med Club.
Philly Med Club.
All right, everybody. Well, is there anything else you guys want to add whatsoever? All right. We're going to be doing another podcast sometime soon, and we're definitely going to be doing a series where we're going to be educating you guys a lot more on this stuff. I appreciate you guys for having me. We're going to finish up this IV bag. Oh, I guess I'm already done my IV bag. But I guess I felt it within me that we were done. But I appreciate you guys for having me. Thank you, Dr. Wayne. I appreciate, you know, the education you guys are giving me. And like I said, stay tuned for the series, everybody. They're going to be doing a lot more content with me, and I want to actually make sure that I'm putting this out here for everybody. Thank you guys for everything. We are out of here.
Appreciate it.